It is natural as we get a little older that some things might not work exactly the way they used to. You might feel a bit less energetic, notice a new ache or pain you didn't have before, or find yourself needing reading glasses more often. These are just part of the journey, aren't they? Most of the time, these changes are minor, something you adjust to and carry on with life. But sometimes, a change, even a subtle one, can cause a quiet worry. Maybe it's something you don't feel comfortable talking about, even with close friends or family. It might feel embarrassing, or like it's just a sign of getting old that you have to accept. But what if ignoring that feeling, pushing that quiet worry aside, means missing something important? Something that's not just about one specific function, but potentially about your overall health and well-being. Ignoring these early signals can lead to more frustration and difficulty down the road. There are certain changes that men specifically might notice as they get older, and one area that causes a lot of unspoken concern is erectile function. It's a topic that many men shy away from discussing, perhaps out of pride or discomfort. But urologists, doctors who specialize in men's health, particularly the urinary and reproductive systems, want you to know that certain early signs should never be ignored. These aren't necessarily signals that something is drastically wrong, but rather gentle nudges from your body telling you to pay attention. Catching these signs early can make a significant difference in how easily they can be addressed, and sometimes they can even be indicators of other health matters you should know about. In this video, we're going to talk openly and honestly about 3 specific early signs of erectile dysfunction that urologists recommend you pay close attention to and why they are important. Don't just brush them off as just getting older. Understanding these signs is the first step towards addressing them and maintaining your quality of life. Watch right through to the end for something that will surprise you about why paying attention to these signs is even more crucial than you might think. Let's start by looking closely at the first of these early indicators that urologists point to. It's often subtle, something you might dismiss initially, but it's worth paying attention to because it represents a change from what was normal for you. This first sign is occasional difficulty achieving or maintaining an erection that is firm enough for satisfactory sexual activity. Now, the key word here is occasional. We're not talking about a situation where it never happens or is consistently difficult. That might indicate a more advanced stage of difficulty. The early sign is when you notice that sometimes things just don't quite work the way they used to. Maybe it's not every time, maybe it's only under certain circumstances, but there's a noticeable difference compared to how things were before. Think back a few years. Was getting and keeping an erection something you generally didn't have to worry about? Did it happen reliably when you were aroused? If you're now experiencing situations where, even when you feel mentally aroused, your body isn't quite responding as it typically would, or you lose the firmness sooner than you'd expect, that intermittent issue is a signal. It's like the engine light flickering on in your car. It might go off again, and the car still runs, but it's telling you something needs checking. Why is this occasional difficulty considered an early sign, and why is it so important not to ignore it? Well, achieving and maintaining an erection is a complex process that involves your brain, hormones, nerves, muscles, and importantly, your blood vessels. It requires a healthy blood supply flowing freely to the penis and then being trapped there to create rigidity. Occasional difficulty, especially if it wasn't a previous issue, can be one of the first hints that there might be a subtle impairment in one or more of these systems. Often, in the early stages, the body can still compensate. Maybe with more stimulation or under different circumstances, things still work. But the fact that it's sometimes not working as reliably suggests that the system isn't as robust as it once was. One of the most common underlying factors related to erectile function is blood flow. Erections require healthy arteries to deliver blood efficiently. Think of your arteries like pipes. Over time, especially if you have risk factors like high blood pressure, high cholesterol, diabetes, or if you smoke, those pipes can start to get a bit clogged or less flexible. This process, often called atherosclerosis or hardening of the arteries, doesn't just happen in the large arteries supplying your heart or brain. It happens throughout your body, including the smaller arteries that supply the penis. Because the arteries supplying the penis are smaller than those supplying the heart, they can often show the effects of poor blood vessel health sooner. So, occasional difficulty with erections can sometimes be an early indicator that there are changes happening in your vascular system, your blood vessels, that could potentially affect other parts of your body down the line, including your heart. That's why ignoring this sign isn't just ignoring a potential issue with sexual function. You might be ignoring a potential early warning signal about your cardiovascular health. It's also important to consider that occasional difficulty can be linked to other factors too, which are often easier to address when caught early. Stress, for example, can have a significant impact on erectile function. If you're going through a particularly stressful period, either personally or professionally, you might notice that things are less reliable. Stress affects hormone levels and can constrict blood vessels. Mental health factors like anxiety or depression can also contribute. Sometimes, early ED can be linked to the psychological pressure and anxiety about having an erection. The worry that it won't work can actually make it harder for it to work, creating a frustrating cycle. Noticing occasional difficulty early means you can start exploring these possibilities with a doctor. They can help you identify if stress, anxiety, or another psychological factor is playing a role and guide you towards strategies to manage it. Addressing mental health early is always beneficial, and sorting out its potential impact on erectile function can relieve a significant burden. Certain medications can also contribute to occasional difficulty. Drugs for high blood pressure, depression, anxiety, even some common over-the-counter medications can affect erectile function. If you've recently started a new medication and notice occasional difficulty, it's worth discussing with your doctor. Often, there are alternative medications or dosage adjustments that can help without compromising your treatment for the primary condition. The key is to recognize the change and discuss it. Lifestyle factors, too, can start showing their impact with occasional issues. Lack of sleep, poor diet, lack of exercise, or excessive alcohol consumption can all put stress on your body's systems that are necessary for healthy erections. In the early stages, these might just cause occasional problems, but if continued, they can lead to more consistent difficulties. Noticing the occasional issue gives you an opportunity to look at your lifestyle and make changes. Simple steps like improving your diet, increasing physical activity, losing excess weight, reducing alcohol intake, or quitting smoking can often improve blood flow and nerve function, potentially reversing or significantly improving these early, occasional difficulties. Catching it early makes these lifestyle changes much more likely to be effective than trying to implement them when the problem is more severe. So, when a urologist talks about ignoring early signs, that occasional inability to get or keep an erection firm enough is high on the list. It's not about feeling like you've failed or that something is fundamentally broken. It's about recognizing a signal from your body. It's a signal that the complex interplay of systems required for healthy function might be facing some challenges. These challenges could be physical, related to blood flow or nerve signals. They could be psychological, related to stress or anxiety. They could be linked to medications or lifestyle. Whatever the cause, the occasional nature of the problem is often what makes men dismiss it, thinking it was just a one-off or they were tired. But if it happens more than once, if you start noticing a pattern, even an infrequent one, that's the time to pay attention. It's easier to identify the root cause and implement solutions when the problem is occasional rather than constant. Early intervention means you can often use less invasive methods, like lifestyle changes or addressing underlying health conditions, before needing more targeted treatments for ED itself. It also gives you a head start on potentially identifying and managing other health issues, like cardiovascular disease, that this occasional difficulty might be hinting at. Think of it as your body whispering a warning, rather than shouting it later on. Paying attention to that whisper allows for a gentler, more proactive response. It's a chance to take control of your health and well-being rather than waiting for a more significant problem to force you to act. It's about maintaining not just sexual health, but overall vitality. Now, having considered that first potential indicator, let's move on to another early sign that many men might notice and potentially overlook. Moving on from that occasional difficulty, another early sign of erectile dysfunction that urologists often emphasize is a noticeable decrease in the firmness of erections when they do occur. This is different from the first sign, which was about whether you could get or keep an erection. This second sign focuses on the quality of the erection you achieve. Perhaps you can still get an erection and you might be able to maintain it for a period, but you notice it's simply not as hard or as rigid as it used to be. It might feel less full or not quite firm enough for penetrative sex, even if some degree of erection is present. This change in firmness is another important signal that should prompt you to consider talking to a doctor. Why is reduced firmness a significant early indicator? Again, it comes back to the underlying physiology. An erection requires a significant volume of blood to engorge the erectile tissues in the penis, and for that blood to be effectively trapped there. Reduced firmness suggests that either the blood flow into the penis isn't as strong as it should be, or the mechanism for trapping the blood within the penis isn't working as efficiently. Both of these issues can be early manifestations of problems with blood vessel health or nerve function. Let's delve a bit deeper into the blood flow aspect. As we discussed with the first sign, the health of your arteries is paramount for strong erections. If atherosclerosis or other conditions are beginning to affect the smaller arteries supplying the penis, the blood flow might not be sufficient to achieve maximum rigidity, even if there's enough flow to get a partial erection. It's like trying to inflate a balloon with a weak pump. You might get some air in, but it won't be as firm as it could be. Reduced firmness is often a more direct reflection of suboptimal blood flow than occasional difficulty. It signals that the physical capacity for full engorgement is starting to diminish. Furthermore, nerve signals play a crucial role. Arousal triggers nerve signals from the brain to the penis, causing the blood vessels to relax and allow blood flow to increase. If there's any damage or impairment to these nerves, the signals might not be strong enough to initiate the full cascade of events needed for maximal firmness. Conditions like diabetes in particular can affect nerve function throughout the body, including the nerves involved in erectile function. Neuropathy, or nerve damage, is a common complication of uncontrolled diabetes, and it can manifest as reduced sensation and impaired nerve signaling necessary for firm erections. Noticing reduced firmness, especially if you have risk factors for diabetes or haven't had your blood sugar checked recently, should definitely be a prompt to visit your doctor. Early detection and management of diabetes can potentially prevent or slow down further nerve damage. Hormonal balance is another factor. While less common as the sole cause of ED, levels of hormones like testosterone can influence sexual desire and function. Low testosterone levels can sometimes contribute to reduced firmness or difficulty achieving erections. A simple blood test can check testosterone levels, and if they are low, your doctor can discuss potential causes and whether treatment is appropriate. Checking hormone levels is part of a comprehensive evaluation that can be initiated when you report early signs like reduced firmness. It's also worth remembering that reduced firmness can be influenced by lifestyle factors that impact both blood flow and nerve function. Chronic stress, poor sleep, sedentary lifestyle, and unhealthy diet don't just affect whether you can get an erection sometimes. They can also impact the quality of the erections you do get. If you notice a decline in firmness, it can be a powerful motivator to assess your lifestyle. Are you eating plenty of processed foods high in unhealthy fats and sugar? Are you getting enough physical activity? Are you managing stress effectively? Making positive changes in these areas can often lead to improvements in blood vessel health and nerve function, potentially restoring some of the lost firmness. Even small, consistent changes can have a cumulative positive effect over time. Psychological factors can also play a role in reduced firmness, although physical factors are often more directly linked to a consistent decrease in rigidity. However, anxiety about performance or the pressure to perform can certainly contribute to reduced firmness. If you're worried about whether you'll be firm enough, that anxiety can interfere with the physiological process. It's a frustrating cycle where the fear of not being firm can lead to reduced firmness, which then increases the fear for the next time. Talking openly about these anxieties, either with a partner or a therapist, can be incredibly helpful. A doctor can also help rule out physical causes, which can sometimes alleviate the psychological burden. Knowing that there isn't a serious underlying physical problem can reduce performance anxiety and allow for more natural function. So, that decrease in firmness is another important piece of the puzzle that urologists want you to pay attention to. It's not just about whether or not you can have sex. It's a potential window into the health of your circulatory system, your nervous system, your hormonal balance, and your overall well-being. Dismissing it as just getting old means potentially missing an opportunity to address underlying health issues early, when they are often easier to manage. It's a signal to check in with your body and have an open conversation with your doctor. Don't feel embarrassed. Doctors discuss these things all the time, and they are focused on your health. Bringing up reduced firmness allows them to consider potential causes and recommend appropriate tests or lifestyle changes. It's a proactive step towards maintaining your health and quality of life as you age. By addressing this sign, you're not just working towards better erectile function, you're investing in your overall health. Now, let's consider a third early sign that men might observe, one that often happens when they are not even thinking about sexual activity, and which provides another important clue about potential underlying issues. This third sign is a bold change in morning erections. Many men, particularly younger men, experience spontaneous erections upon waking up. These are often referred to as nocturnal penile tumescence, and they indicate healthy nerve and blood vessel function during sleep. As men age, the frequency and firmness of morning erections can naturally decrease somewhat, but a significant change or absence of morning erections, especially if they were previously regular, can be an early warning sign of erectile dysfunction. Why are morning erections so important, and why does their absence or reduced quality signal a potential problem? Morning erections are typically non-psychogenic, meaning they are not caused by sexual thoughts or stimulation, but rather are a physiological event that occurs naturally during certain stages of sleep. Their presence indicates that the physical machinery, the blood vessels and nerves, is functioning correctly, at least at a basic level, in the absence of performance pressure or psychological factors. If you are experiencing difficulty achieving or maintaining erections during wakefulness, but you still have regular, firm morning erections, it might suggest that psychological factors, like anxiety or stress, are playing a significant role in your ED. However, if you notice that your morning erections have significantly decreased in frequency or are much less firm than they used to be, this is a stronger indicator that there might be an underlying physical cause, such as issues with blood flow or nerve function. A decline or absence of morning erections is often one of the earliest physical manifestations of impaired blood vessel health. As we've discussed, the arteries supplying the penis can be among the first to show signs of atherosclerosis or other vascular problems. If blood flow is becoming compromised, it might not be sufficient to trigger or sustain the spontaneous erections that occur during sleep. This is why urologists pay close attention to changes in morning erections. It can help them differentiate between ED that is primarily psychological in origin and ED that has a significant physical component. While both types of ED warrant attention and treatment, the approach might differ, and identifying a physical cause through the presence or absence of morning erections is a critical diagnostic step. Furthermore, the health of your blood vessels, as reflected in morning erections, is strongly linked to the health of your heart. The same risk factors that lead to problems in the penile arteries, smoking, high blood pressure, high cholesterol, diabetes, obesity, sedentary lifestyle, are major risk factors for heart disease and stroke. A significant decline in morning erections can be a signal that these risk factors are starting to take a toll on your vascular system more broadly. This isn't meant to cause alarm, but to highlight the interconnectedness of your body's systems. Your erectile function is often a barometer for your overall cardiovascular health. If you've noticed a significant change in your morning erections, maybe they used to happen most mornings and now they are rare, or they used to be very firm and now they are noticeably softer, it's a sign that warrants discussion with your doctor. Don't just shrug it off as part of getting older. While some natural changes can occur with age, a significant decline often points to underlying physical issues that are worth investigating. Bringing this up allows your doctor to consider things like checking your blood pressure, cholesterol, blood sugar levels, and potentially recommending tests to assess your cardiovascular health. It opens the door to addressing these potential underlying issues early, which is beneficial not just for erectile function, but for your long-term health and vitality. It's important to be honest with yourself and your doctor about this. While it might feel like a private or even embarrassing detail, reporting changes in morning erections provides valuable diagnostic information. It helps your doctor build a complete picture of your health and identify potential causes of any erectile difficulties you might be experiencing at other times. Remember, doctors are there to help, and they've heard it all before. Your health and well-being are their priority. Talking about changes in morning erections is a proactive step towards understanding what's happening in your body and taking appropriate action. These 3 early signs: occasional difficulty getting or keeping firmness, noticeable decrease in the firmness of erections when they do occur, and a change in morning erections, are signals your body might be sending you. They are not necessarily a diagnosis of severe ED, but rather indicators that the system is not functioning at 100% efficiency, and that this warrants attention. Paying attention to these early signs allows you to seek help sooner rather than later. Early intervention for ED is often more successful and involves less invasive treatments than waiting until the problem is severe and constant. It can involve lifestyle changes, addressing underlying health conditions like diabetes or high blood pressure, adjusting medications, or exploring psychological factors. So, we've talked about these 3 key indicators: the occasional times when things don't quite work, the noticeable drop in firmness even when you do get an erection, and the changes you might see in your morning erections. Recognizing any of these isn't a signal to panic. Absolutely not. It's a signal to act. It's your body giving you a heads up, an early notification that something might need a little attention. Too many men delay talking about this, often for years, out of embarrassment or the mistaken belief that it's just an inevitable part of aging that can't be helped. But here's the surprise I mentioned at the beginning, and it's something urologists understand profoundly. Erectile dysfunction, particularly when it starts subtly with these early signs, is often one of the earliest and most powerful indicators of cardiovascular disease. Think about it. The arteries supplying blood to the penis are relatively small compared to the major arteries in your heart or brain. This means they can be affected by the early stages of plaque buildup or hardening, atherosclerosis, sooner than the larger vessels. So, difficulty achieving or maintaining an erection can be a warning sign that the same process that could eventually lead to a heart attack or stroke is already underway in your vascular system. Studies have shown that men who experience ED, especially at a younger age, though it's relevant at any age, have a significantly higher risk of developing heart disease or having a stroke in the following years compared to men without ED. It's not that the ED causes the heart problems. They often share the same underlying cause: unhealthy blood vessels. This link is the crucial takeaway. Ignoring early signs of ED isn't just risking your sexual health. You could be missing a critical opportunity to assess and improve your cardiovascular health, which is vital for your overall lifespan and quality of life. When you talk to your doctor about these early signs of ED, they should not just think about prescribing a pill for erections. They should also be thinking, okay, this is a potential red flag for this man's heart health. They should be considering checking your blood pressure, your cholesterol levels, your blood sugar, and discussing other risk factors like your weight, diet, exercise habits, and smoking status. Addressing these cardiovascular risk factors is not only good for your heart and brain, but it can also significantly improve or even reverse early erectile difficulties. This is the surprising part for many men, that their erectile function is so closely tied to their heart health. It shifts the conversation from something purely about sexual performance to something fundamentally about overall health and longevity. It's a powerful motivator to seek help and make positive changes. Addressing high blood pressure, high cholesterol, diabetes, or lifestyle factors like smoking and inactivity can improve blood flow throughout your body, including to the penis, and reduce your risk of serious cardiovascular events down the line. So, if you've noticed any of these 3 early signs, the occasional difficulty, the reduced firmness, or changes in morning erections, please don't ignore them. See them not as a failure or an embarrassment, but as a valuable message from your body. A message that says, it's time to check in on my health. Talking to your doctor about these signs is one of the most important proactive health steps you can take as you get older. It opens the door to a comprehensive health assessment. It allows your doctor to look at the bigger picture and help you address any underlying issues that could be impacting not just your erectile function, but your overall health and future. It's about taking control, being informed, and working with your healthcare provider to live your healthiest, fullest life. Remember, experiencing these early signs doesn't mean you're doomed. Far from it. It means you have an opportunity to intervene early. ED, especially in its early stages, is often very treatable, and addressing the underlying causes, particularly cardiovascular risk factors, can have profound positive effects on your health that extend far beyond sexual function. Small changes can indeed make a big difference to your health and happiness. Taking that first step to talk to your doctor about what you've noticed is courageous and smart. It's an investment in yourself, in your future health, and in maintaining your quality of life, including intimacy if that's important to you, for years to come. If anything in this video resonated with you, or if you have experience with addressing these kinds of health issues, sharing your thoughts or experiences in the comments below can be helpful for others who might be going through something similar. It helps build a supportive community. And if you found this information valuable, please give the video a like. That helps us reach more people who could benefit from hearing this message. Also, consider subscribing to the channel for more helpful content focused on health and well-being as we age. Taking care of yourself is the most important thing you can do. Live your best life at every age.